What's the best food for diabetes? And what's the worst? Which food is most harmful for diabetics? In this video, I'm going to tell you everything about diabetes. What are some good post-meal practices for a diabetic? What can be considered good? And what can be considered bad? Let's start with a list of the 7 best foods. I'll tell you about the best ones and then the 6 you should avoid. Actually, it's 6 types because the video would be too limited if I only talked about one specific food. So I'm going to talk about categories. Number 1 on the list of the best is vegetables. Vegetables are excellent for people with diabetes, and I'm going to use broccoli as an example here. Why? Broccoli is a source of vitamins and minerals. It also contains calcium and antioxidants that help you in the process of controlling diabetes and often even reversing type 2 diabetes. For type 1 diabetes, the autoimmune disease, there's only management. But with type 2 diabetes, it's often possible to achieve reversal by modifying the factors that cause it, and diet is one of those factors. So improving your diet is one of the steps to gain control, and in some cases even reverse type 2 diabetes. Later, I'll explain the criteria used to consider diabetes reversal, but on the list of best foods, I'm putting vegetables here, highlighting broccoli, radishes, cucumbers, cauliflower, and dark green leaves. They're excellent for diabetics. Arugula and lettuce are also beneficial, as they're sources of magnesium and copper, which can improve the process. Don't forget pumpkin and zucchini, so vegetables are our number 1 item. There are some exceptions you need to be more careful with, which also fall into the worst category. Vegetables that have a higher starch content, like potatoes, corn, and peas. You need to be especially careful with these 3. But generally speaking, vegetables are excellent and make it to the list of the best foods. Number 2, which couldn't be left off the list of the best foods, are fruits. On this list, I want to give a special mention to apples. They are rich in fiber and also contain antioxidants. Remember to eat them with the skin on. If you can't buy organic apples, you can clean the skin with a scrubbing brush. If you're concerned about pesticides, simply scrubbing the apple can significantly reduce their presence. This is a simple and cost-effective way to minimize pesticide exposure. While you can't eliminate all pesticides, especially those absorbed systemically, this method can greatly reduce their levels. Eating apples with the skin on not only provides fiber, which helps with feeling full, but also improves digestion and lowers the glycemic index of other foods. Foods high in fiber aid in digestion, and apples contain pectin, a soluble fiber that can help improve your cholesterol levels. We know that diabetics need to be careful with cholesterol due to cardiovascular risks, including the risk of heart attack and stroke. That's why it's crucial to consume fiber-rich foods with a low glycemic index and low glycemic load, meaning they're low in sugars. Apples tick all these boxes, making them an excellent choice. What other fruits are also considered among the best? Red fruits, for example. Strawberries, lemons, and avocado also have good fats that help with cholesterol issues. They have significantly lower sugar and carbohydrate content, so avocado is an excellent choice. Guava, orange with pulp for the fiber, peaches, and nectarines are excellent fruits for people with diabetes. And I can't forget to mention passion fruit. There are so many great fruits, but passion fruit definitely deserves a spot on the list. So, fruits with a low glycemic index, which measures how much a food raises your blood sugar when you eat it, are ideal. These fruits won't cause a spike in your blood sugar levels, so you won't need a corresponding spike in insulin. There's a question here about whether an insulin spike would be harmful or not. If you don't have diabetes, your body can control this on its own, so you can eat some foods that will temporarily increase your blood sugar and cause an insulin spike. And this is physiological. It's normal. You won't become sick because of it. Now, if you already have diabetes, during this insulin spike, insulin can no longer act effectively. It can't perform its function of taking sugar from the blood and putting it inside the cells and muscles. So this is definitely something diabetics need to pay close attention to. It's not just about the insulin spike, it's about the insulin spike in diabetics, which can cause a change in blood sugar levels. Number 3 on the list of best foods for diabetics: fibers and seeds. Number 4, I've never mentioned this before, but you guys ask about it a lot. Pumpkin seeds and sunflower seeds are indeed good for people with diabetes. They contain various vitamins, help with daily fiber intake, affect the glycemic index of foods, improve absorption, and slow down the absorption of these foods, which in turn reduces blood sugar spikes. So these fibers are excellent. And 2 that you're already familiar with are chia seeds and flaxseed. Many people ask if golden flaxseed can be used. Yes, it can be used. There's no problem with that. It really comes down to your personal preference. How do you plan to use them? Of these fibers, I use chia seeds. Which one do you use? I like to add chia seeds to yogurt and mix them with fruits, but it's really up to your taste. I'd even invite you to share your recipe here in the comments. If you use these fibers, let us know how you use them. This serves as a suggestion for other diabetics and also contributes to the richness of this video. I know you're going to ask about oatmeal. Is oatmeal good or bad for people with diabetes? Whenever we talk about fibers like chia, flaxseed, and other seeds, you always ask about oats. Oatmeal is not good for people with diabetes. Oats are healthy, yes, but only if you don't have any issues with your metabolism, blood sugar, or insulin. Why? Because more than half of oats' composition is sugars. Some studies say it's over 65%, others say 60%. It varies quite a bit, but everyone agrees that most of its composition is sugars. And if you're diabetic, you need to be especially careful with sugars. I'm not trying to badmouth oats. I eat oatmeal myself. Oatmeal has properties that can improve your cholesterol levels. More specifically, for diabetics, which is the topic of this video, you need to be extra careful. And if possible, replacing oats with other fibers I mentioned would be a great choice. Number 4, eggs. Eggs are a source of protein, lean protein. And here I'm talking about whole eggs, both the yolk and the white. Many people recommend removing the yolk because of the fat, but that doesn't make sense. The yolk contains good fats and vitamins that help with cognition and vision. B complex vitamins. So it doesn't make sense to remove the yolk. You should eat the whole egg. I'm talking about 1 to 2 eggs per day. If you eat more, well, there are many athletes. You've probably seen some videos, those people who go to the gym and then eat several eggs. In that case, yes, those people might need to remove the yolk because of the quantity. Now, for those of you who eat 1 or 2 eggs a day, which is a very healthy amount, don't worry. Fat isn't going to harm you. On the contrary, eggs contain good fats along with vitamins and minerals that can actually help boost your metabolism. So eggs are definitely a good choice. I eat eggs every day myself. I consider them an excellent and very well-rounded food. Keep in mind that if you're diabetic, you need a minimum amount of protein, and eggs can really help you meet that requirement. Number 5, olive oil. Olive oil is a powerful anti-inflammatory and also contains healthy fats. So what's the recommended dose of olive oil for cardiovascular protection? 7 to 10 milliliters per day is a safe amount of olive oil that provides benefits without adding excess calories. What's the downside of olive oil? While it's high in calories, it contains good fats that can benefit your heart and won't raise your blood sugar. The main issue is its calorie content, so you need to be careful. If you use the amount I mentioned, you'll be doing something good for your health. Many people ask, if I put olive oil in a frying pan, won't it transform from a good fat into a bad fat? No, that doesn't happen. This transformation only occurs at extremely high temperatures. You can't actually reach the temperature needed to turn olive oil into a harmful substance on your home stove, for example. So you can relax. You can safely saute vegetables in olive oil without any issues. There's no need to worry about the smoke point of olive oil, despite what many internet videos might claim. You can't transform it into an unhealthy food on your home stove, so there's no reason to be concerned. Feel free to use olive oil for heating and cooking foods as you prefer. It's much better to use olive oil than butter, margarine, or other animal fats like lard or even vegetable fats. Coconut oil itself is high in saturated fats. In fact, most of coconut oil is composed of saturated fats, which can increase your cardiovascular risk. Not only do you get excess calories, but you also face an increased health risk. Diets high in saturated fats increase the risk of cardiovascular disease, and diabetics should pay extra attention here. Number 6. Fish and seafood like shrimp. Shrimp is excellent for people with diabetes. Lobster, crayfish. I know many people will say lobster is expensive, but we have to remember that people from all over the world watch this channel. In many countries, lobster is affordable, just like fish, such as tuna, salmon, and sardines. But I'm not going to limit it to just these omega-3 rich fish. I'm including fish in general here because they're sources of lean protein that can help you in this process. Now regarding seafood like shrimp, lobster, and even some fish I mentioned, if you have high uric acid, known as hyperuricemia, you'll need to be extra careful because seafood can significantly increase uric acid levels. However, if you're diabetic and your uric acid is under control, then these are excellent choices and make the list of best foods for diabetics. Remember, I promised to talk about the criteria for reversing type 2 diabetes and what's considered a good test result for diabetics? What's a good blood sugar level when you test with a device like a glucometer or glucose meter? I'll start by discussing the criteria for reversing type 2 diabetes. Keep in mind that this isn't my personal opinion. This information comes from the American Diabetes Association, which is currently our leading authority on the subject. What exactly are these reversal criteria? We use a test called glycated hemoglobin, which measures the average blood sugar level over the past 90 days. What are the significant values for glycated hemoglobin? A normal value would be up to 5.6. Pre-diabetes ranges from 5.7 to 6.4%, and diabetes is 6.5 or higher. Keep in mind that ideally, you should repeat this test twice to confirm a diabetes diagnosis. If you're already being monitored, you don't need to repeat this test. But what's the criterion for diabetes reversal? If you maintain values below 6.5 for 3 months or more after your doctor has discontinued your diabetes medications, that's considered a reversal. If you're taking any medication, then this criterion doesn't apply. It's really important to remember that this happens quite often in practice. I've heard patients say many times that their result was good, thinking it's a reversal. But if you're taking medication, it doesn't meet this criterion. Remember, only your doctor can tell you when to stop taking a medication or when to start a new one. When it comes to diabetes and blood sugar levels, there's a very dangerous condition called hypoglycemia. It's just as dangerous as hyperglycemia. Extremely low blood sugar can also be a medical emergency, so it's crucial to always keep this in mind. Now, let's talk about what are considered good values in the capillary glucose test, the one you do with a glucometer or glucose meter. We typically use a 2-hour post-meal measurement to see how food impacts the blood sugar levels. For diabetics, values up to 180 milligrams per deciliter are considered good. If you're in a country that uses millimoles per liter, that value would be up to 10. We use these values to determine if blood sugar levels are under control after eating. Now you might be thinking, wait, isn't up to 180 or 170 still pretty high for fasting levels? Yes, it would be. But remember, we're talking about post-meal values or postprandial levels. So, Values up to 180 milligrams per deciliter or 10 millimoles per liter are considered acceptable. For non-diabetics, I know you'll ask this too, values up to 140 milligrams per deciliter or 7.8 millimoles per liter are considered acceptable. Did you enjoy this video? On a scale of 0 to 10, how would you rate it? Come on, this video deserves a 10, doesn't it? I've included a lot of important information in this video. It's the first one where I'm going to ask for a 10, and I hope you think it deserves that too. Let me know in the comments which city and part of the world you're watching from. I'm curious to see how far this video has reached. I'm speaking to you from Porto Alegre. Now I'd like to suggest another video for you to watch. It's one where I talked about coffee. Did you know that coffee has benefits for people with diabetes? Would you like to know about the other benefits of coffee? In that video, I also discussed the potential risks. It's definitely worth watching if you're a coffee drinker or if you're thinking about starting because of this information. It's better to be informed. Take care, and I'll see you next time. Don't forget to like and share this video to spread health knowledge.